I'm Jenni Middleton, editor of Nursing Times, and I've had a great couple of days at the Florence Nightingale Foundation annual conference. I think this is probably the fifth one that I've been to, and I really wouldn't miss it. I get such an enormous amount out of coming of these 2 days. It's an amazing event to come to. The best thing about it is probably the networking. Liz, Rob and her team do an absolutely fantastic job of getting some amazing speakers lined up on the agenda, and it's like a who's who of nursing when you turn up here through the door. You see fantastic people, the Florence Nightingale scholars, people that are working in senior levels, policy makers. It's amazing. It really is a great place to network. The agenda, when I see it sometimes, I sort of think, why is that person on the agenda? And then when they start speaking, I'm an absolute convert, because I can absolutely understand why Liz has selected them and her team have put them on the agenda. And I always learn so much from the speakers, even if I wasn't quite sure about what I might learn before they started their presentation. A really good example of that, I think, was probably the GP who kicked off the session pretty early yesterday from Bromley by Bow. It was Sir Sam Etherington, and he was an amazing advocate for sort of collaboration and co-production with patients, which is something I think we've really got to think about, and it's been a massive message that we've heard from a lot of the speakers over the last couple of days. We saw it picked up again by Josta Block, but some of the things they've been talking about were a leg ulcer club that's also a flower arranging club, and a walker race which happens in the Netherlands for people with their walkers, and a diabetes festival which celebrates what people can eat and how they should manage their condition with diabetes. So that is absolutely fantastic work, and what's great about all of those is it's nurses that's leading that change. Nurses are responsible for sort of being in the driving seat and really changing the way that they work and integrate with their local communities and take responsibility for that. There's some great public health messages coming out of the last couple of days. Also fantastic to hear from the 4 UK CNOs this morning. It was brilliant to see Fiona McQueen from Scotland and Jean White from Wales talking about the work that they're doing around their strategies. Obviously Hilary Garrett was representing Jane Cummings, and that was also fantastic to get a bit of a sneak preview on what the NHS England strategy is going to be for nurses and midwives. And then Charlotte McArdle from Northern Ireland talked about the work that she's doing representing the 4 CNOs with the NMC to bring the code to life and how that can be used in revalidation. There was a lot of talk around reflections and how many reflections will be able to be counted as a result of that revalidation work, and how we can use that together to really inform practice and produce great, consistent, quality practice. This has been really an amazing couple of days, and I have to say that it's a fantastic conference, and I really wouldn't miss it. So I've really enjoyed every moment of it. Thanks very much again to Liz and her team.
For people who were thinking about coming next year, so that would be your 6th year, what would you say to them?
I think it's really worth giving up the couple of days to come here. I know it's difficult to take time out, and sometimes it's hard to sort of make a case for coming to events like this, but you really do take away so much. I mean, I've got so many great contacts for things that we're going to write about in Nursing Times, but I've also heard about so much great work, and I'm sure that there aren't many people who've come here and haven't got a takeaway of something that they can do and improve when they go back to their organisations or when they go back to practice again next week.